Welcome to another lesson of discussion whereby we shall be discussing about this bone of the face or facial bone known as the maxillae. The paired maxillae or jaw bones, singular is maxilla, unite to form the upper jawbone holding the tooth. They articulate with every bone of the face except the mandible, which is the lower jawbone. The maxillae form part of the floors of the orbits, part of the lateral walls, and floor of the nasal cavity. Also, as well, a part or parts of the hard palate. The hard palate is the bony roof of the mouth and is formed by the palatine processes of the maxilla and horizontal plates of the palatine bones. It separates the nasal cavity from the oral cavity. Each maxilla has a central body which is hollowed out internally to form the mucosal-lined maxillary sinus. So let's get to the bony skeleton of the skull so that you can be able to identify the exact location of this maxillae. This is the anterior view of the skull, and for the maxillae dominates this area of the face. Can as well be able to identify other bones of the face, including the nasal bone, as you can see. So for the maxillae, lies at this region, and for the upper dentition, you can be able to see the tooth or the teeth of the upper jaw, and few of the structures within the maxilla, including the alveolar process of the maxillae, where the roots of the tooth originates. We as well have other bones which are easily seen, including the vomer, have the inferior nasal concha, other bones including the perpendicular plate of the ethmoid bone. Remember from our previous or other channel, we were able to identify these bones of the face. This is a disarticulated skull, and the position of the maxillae is right here. There are two. We have the one on the left, the other one on the right. We as well have other bones, including the zygomatic bone, of which we shall check on that later. This is the lateral view of the skull, and the position of maxillae is right here. Well, we have at least a detailed image, and this is the anterior view of this articulated skull with other bones which are included. And for our major concern, we can check for the facts about the maxillae. And for the part labeled 22 right here is the frontal process. We have as well the part labeled 27 is the infraorbital foramen. And we have the part labeled 26 is the alveolar process. Remember, I did explain that a little bit. We as well have the part labeled 23 is the palatine process, and we also have the part labeled 24 is the zygomatic process, of which they're all parts of the maxilla. This is the bone itself, or the bones of the maxilla, and we have the anterior view. You can as well find the structures, including the zygomatic process right there. We have the frontal process, infraorbital foramen, canine fossa, nasoalveolar clevus. Then, as we can see from the posterior view, we have the palatine process right here. Remember, this other one is the zygomatic process, and this other one is the frontal process. From the medial perspective, we have the maxillary sinus right here. Then from the lateral view, we have the anterior lacrimal crest, which is located right there. Then we have the anterior nasal spine. We have the canine jugular or jugular. We have as well the alveolar process, where the roots of the tooth originates. Then from the superior view, we have the infraorbital sulcus, which is right there. From inferior view, you can find other structures, including the greater palatine groove, located right there. Then we have the incisive foramen. As we will be getting along, we'll be able to find out what are the major roles of these structures within the these bones. We as well have the alveoli, which is located right there. So let's get to the surface anatomy of the descriptive part of this bone known as the maxillary. Alveolar process is the horizontal portion, the ridge-like arc that contains the alveoli, which is the sockets for the maxillary that holds the roots of the tooth. Alveoli itself for the tooth root are present along the alveolar process. Canine jugum is a bony eminence over the maxillary canine root on the facial surface of the maxillary. The zygomatic process forms much of the cheek. Then infraorbital foramen is located below the inferior orbital rim on the facial surface and transmits vessels to the face. So they're the neurovascular elements which are transmitted through this infraorbital foramen. So we have a detailed images of maxillae, and we have this other one on the right. This is the anterior view of both maxillae, right and left. Then we have at least the view from below. Let's get to the structures of which we've been able to discuss, including the zygomatic process and other structures. For the part labeled 22 is the frontal process. Then we as well have the part labeled 27 is the infraorbital foramen, of which we've been able to identify. We as well have this part, which is 29, and that is the anterior nasal aperture. Then we have 30 is the anterior nasal spine. The part labeled 26 is the juga alveolaria. And then we have the part labeled 27 is the infraorbital foramen. So remember, infraorbital foramen is located at least on both right and left maxillae. We have the part labeled 24, which is the zygomatic process. 21 is another alveolar process. Then 25 is the alveolar process of the teeth as well. Then we can move to other parts of this bone, or the same bone, which is the maxillae. We have the part labeled 31 is the central incisor or incisive bone or premaxillae. The part labeled 32 is the incisive fossa or the incisive foramen. So this is the whole structure of this bone, which is the maxillae. Anterior nasal spine, of which we've been able to identify as this part, the anterior nasal spine. So what's all about that is a thin projection of bone on the midline of the at inferior margin of the nasal aperture. So that's all about that. The infraorbital sulcus or the groove is centered on the posterior half of the orbital floor that opens posterior superiorly, and it connects anterior inferiorly with the orbital foramen via the infraorbital canal. Maxillary sinus is the large void in the body of the maxilla superior to the alveolar process and inferior to the orbital floor. The canine fossa is a hollow or variable extent located on the facial surface just below the infraorbital foramen, where the zygomatic, frontal, and alveolar process of the maxilla come together. So that's the part labeled as canine fossa. So we've been able to identify those structures which I've mentioned. We have the frontal zygomatic process. Remember, this is the same image as the one we've been able to identify from the previous page. So just to review those parts, we have the zygomatic process, frontal process, infraorbital foramen, canine fossa, nasoalveolar cleavers, and the maxillary sinus, which we've been able to describe from the above description. Infraorbital sulcus are just here. We have the palatine process located there. Then we have the anterior lacrimal crest, anterior nasal spine, canine jugum, alveolar process, where the roots of the tooth originate, the greater palatine groove. Here, then incisive foramen right there. Finally, the alveoli. The frontal process rises to articulate with the frontal nostrils and lacrimal, and as well the ethmoid. Anterior lacrimal crest is the vertical crest located on the lateral aspect of the frontal process of maxillae. The maxillae combines with the lacrimal bone to form the lacrimal groove or the canal. This canal houses the lacrimal duct, which drains tears to the inferior nasal cavity. So, as you'll be reading from your physiology, you'll be able to identify the main function of this duct, which is the nasolacrimal duct. Incisive foramen perforates the anterior half palate at the midline of that bone, which is maxilla. Greater palatine groove at the rear of the hard palate marks the junction of the palatine and alveolar process, and this groove is for greater palatine vessels and nerves. So, sorry, I should repeat this. The statement about incisive foramen are just some typing error. This is the hard palate. So, incisive foramen perforates the anterior hard palate at the midline. So that's all about that. Sorry for inconvenience. So for the frontal process, it's dominated by the part labeled 22 to be able to identify what's its major function. The maxillary tuber is a rugose surface at the posterior end of the alveolar process. And for the nasoalveolar cleavus is the surface between canine jugae and the base of the piriform aperture and the alveolar margin. Incisive canal is a bilobate opening via the incisive foramen, with each lobe enclosed by one of the maxillae. Each lobe of the canal transmits the terminal branch of the greater palatine artery and the nasopalatine nerve. So that's the function of this incisive canal. Premaxillary suture is sometimes seen in the wall of the incisive canal and the adjacent palatal surface.